Okay. My name is Fred Folta, F-R-E-D-E-R-I-C-K. Shit. You want to start that over again?
Go ahead.
Okay.
We're going to roll into it.
All right. My name is Fred Folta, F-R-E-D-F-O-L-T-A. I am a paramedic. Hello, my name is Fred Folta. I am a paramedic of 22 years.
What made your decision on being a paramedic?
I started out as an EMT, and I had a call. It was very bad. It was on a highway. It was a trauma, and I felt that I just was unable to do enough to care for this person. So I decided to continue my education and become a paramedic.
What was your worst call ever?
I actually have two of them. The one was the reason I decided to become a paramedic. It was a trauma. It was very bad. We landed a helicopter in the middle of a highway. I just felt helpless that I couldn't do enough to help this person. And they were just really bad, and I just couldn't do enough. The second one is I was taking care of somebody, and my ambulance caught on fire. And while I was trying to care for them, I had to get them out of the ambulance and continue to care for them on the side of the road while my ambulance went up in flames. Those were pretty bad.
What is the difference between an EMT and a paramedic?
An EMT, their level of training is called BLS, which stands for Basic Life Support. They can stop the bleeding, they can do CPR, they can splint limbs, and just take basic sets of vitals. Paramedic goes a little bit more in depth than that, where we can give medications. We use a monitor, so we can look at your heart, otherwise known as an EKG. And we can do a lot of things that the doctors can do. We put the heart monitor on, I can tell you what your rhythm is, and then I have to figure out what drug I need to change that rhythm back to something that is life-sustainable.
Have you ever seen a dead person?
I've seen many. When we get called for a cardiac arrest, 9 times out of 10, they're dead, but they have electrical activity in their heart that we can convert back to normal. Or we get called to what's known as a DOA, where they're dead before we even got there, and then we have to call the coroner and stick around and help with the coroner's investigation and extrication of that body.
Have you ever brought anybody back from the dead?
I have. Again, we get called for a cardiac arrest, and we know that there's what time they went down. If it's within a certain time limit, they're still viable, and we can perform CPR, start IVs, and give specific drugs to restart their heart.
What are some of the responsibilities of a paramedic?
Well, it starts out in the station before we even have a call. We check our ambulances to make sure all our supplies are there, make sure that all the drugs that we have are not expired, make sure we have all the equipment that we need to administer those medications, and then, of course, patient care. Whenever we get a call, we have to assess the scene first and then the patient, make sure we know what we're going to be doing, and make our determinations upon our findings.
What type of calls do you get the most?
Mostly difficulty in breathing and chest pain. They're pretty much even. A lot of times we get called for difficulty in breathing. It turns out to be chest pain or a cardiac issue. The other half of the time we get called for a chest pain, and it turns out to be respiratory. It can go either way, really.
How do you deal with that at the personal level?
It's not that easy. A lot of us in emergency medical services have a sense of humor that most would find appalling. But it's how we deal. If we can't find a way to joke or laugh, not by any means making fun of anyone, we just have to find the humor where most people couldn't find humor, because if we didn't, we wouldn't mentally be able to continue this job.
What do paramedics do when they find someone unconscious?
Well, we get there, we make sure that our scene is safe to make sure that nothing's going to hurt us so that we're still able to take care of that person. We find them unconscious, we make sure that they're breathing, we see if their heart is still beating, and we see if there's any responsiveness. Whatever we find from there, that's whenever we determine what course of treatment that we're going to administer.
What are some of the life-saving medications paramedics carry with?
We carry epinephrine, we carry atropine, we carry Narcan, we carry adenosine, and several others actually. Each does their own thing depending on what we find. That's why we have to be trained with the use of an EKG. And, you know, we don't technically diagnose, but we diagnose what's going on and treat accordingly. We also carry albuterol. If you'd like, I could tell you what each medication is used for, but those are just a few that we carry with us.
Can you explain how a paramedic responds to a crime scene?
Well, a lot of times we get on scene and we don't even know it's a crime scene until after we get there. The way we determine that is, one, by what we see. When we get on scene, we have to take a quick look to make sure, one, everything is safe, and two, make sure it doesn't even look like a crime scene. There's a lot of different things that go into determining that. We also figure that out by talking to the bystanders that are on scene to see what had happened before we arrived. Then we can make a decision on whether to call the police or not. Once we determine that it is a crime scene, we only treat the patient. We make sure we disturb as little as possible. We don't want to disturb anything that would hinder the investigation of the police officers or investigators or whoever may be involved.
How do you treat a patient with broken bones?
Every broken bone is different. It just depends on where the bone is, what the bone is, and what type of fracture it is. You know, if we see displacement of a bone, we don't put it back. We don't. I totally lost my word. I'm sorry.
No, that's okay.
We don't set it, or otherwise known as reduce it. If it's a femur fracture, we can reduce that. We have a piece of equipment called a traction splint that we put on a person's leg, and then what we do is we stretch that leg until the bone is reduced and comes back to its normal place. The way we know that we have it done properly is the patient is screaming in pain. We give them something to help with the pain, but it never takes it away, and then we reduce that fracture until they are no longer in pain. But for most fractures, we just do a basic splint and transport them and treat them with pain control.
What are some common misconceptions about your job?
People call us ambulance drivers. They think that that's all we do, especially the older people. Back in the day, whenever EMS first started, they would just come pick people up, throw them in a vehicle, and run them to the hospital. We don't do that no more. We actually check our patients. We diagnose our patients, or diagnose what we think they may be. We treat. We actually help people. We can take a fast heart and make it slow again. We can take a slow heart and make it a normal rate again. The biggest misconception is that we're just drivers.
Name a time when your patient was tested. How did you keep your emotions in check?
Our patients get tested a lot. A lot of times we'll be called to help somebody, and we get there, and people with absolutely no medical training try to tell us how to do our job. We have specific training. We do continuing education to make sure that we are up to date with our specific training. And when someone who doesn't have a clue or has no training at all tries to tell us how to do our job, that tests our patients a lot. Families, we understand they care about their loved ones. but whenever they become intrusive, it stops us from doing our job in a lot of times. So we have to take the time away from treating our patient to talk to them, to get them to understand the more you're doing what you're doing is slowing down and hindering our treatment, because we can't do what we need to do while you're in the way. We have to do that as nice as possible, when really we just want to lash out and yell at them and just say, get out of the way, or whatever the case may be.
Would you recommend your job?
Yes and no. It's kind of a loaded question, but I'll do my best to answer that. I'd recommend it because, yes, it is pretty fulfilling, especially whenever we have the bad calls that have a good ending. There's a lot of training that goes into it. It's very difficult. But the reason I would not recommend it, especially as a career, is because once you get to a certain point, there's really no moving up. The pay is terrible. We treat patients without ever talking to a doctor, where people with higher training than us have to get a doctor's orders for every little thing that they do. I can treat a patient, for the 30 minutes that I'm with them and never once ask a doctor if I'm allowed to do it or not, because we follow protocols. We can choose different protocols depending on what we find and continue to treat these patients. We don't get the recognition that I feel we deserve. It's just a very difficult situation. So yes, I would recommend this job, in my opinion, as a hobby. If you go to a bigger city, it's a little bit better. There is room for moving up. There's room for continuing, advancing. In small cities like where I work, there's really no further advancement. And again, the pay is difficult. Every single one of us have to work more than one job just to support ourselves and our families. And it is very taxing.
Hey, thank you a lot, Fred, for doing this.
You're very welcome.
Well,
Is that good? Is that 10 minutes worth?
I hope.
Check you out. I hope. You don't have a counter on that thing to let you know?
Action.
Hi, my name is Bill Rodbush, BillRoudabush. My name is Bill Rodbush. This is my story.
Hey, Bill. What are some of your favorite things you like to do?
Well, fishing and woodworking.
What is the one past memory that you have that you'll never forget?
Well, I don't know about that.
Maybe the time you died?
Yeah, I mean, there is, when I died, my daughter found me dead in our vehicle, which the doctor had me on methadone for my back pain, and methadone caused me to have an overdose, and she found me dead in our pickup truck down at the fairgrounds in 06. We had a booth in the fair too, and we were setting up the booth, and our last load, I walked out of the building to pull the truck around, and my last memory was walking out of the building, and I don't know how I did it, but I pulled the truck around and backed it right in front of our horse trailer and parked it exactly. And that was on a Sunday, and I woke up Tuesday afternoon. I don't remember anything in between there.
Okay, well, my next question is anything that you can remember while you was laying there dead? Can you remember anything?
No.
Nothing? It was
can't.
black?
I don't remember anything. I woke up.
How did you feel when he brought you back?
I I believe in prayer. I mean, my wife and the women from the church and everything. Prayer is what brought me back. Because the paramedic and everything on the ambulance crew said, well, we don't know if he's going to make it or not. Was what the last paramedic told my wife when they took me in the ambulance.
So did this change your life, or did
Oh
you
yeah, I
do things
mean,
differently than that?
oh
once
yeah,
occurred?
yeah. There was other means. I mean, I must have been here for other things because I don't. I mean, we started doing more for the kids and everything else, and doing cart rides for birthday parties and that, and taking the miniature horses to nursing homes, and I had to be here for different things like that.
How many surgeries did you have in your life?
About 25. I'm going on my 26th surgery coming up soon on my hip.
Oh, what are some of the surgeries you had done?
Well, I've had 6 cervical surgeries on my neck, my discs. 5 out of 7 discs was replaced, and both knee, one scoped 5 times and then replaced, and the other one scoped 2 times and then replaced. And both carpal tunnels and my gallbladder and appendix. Well,
You plan on getting any more?
well, this hip is getting really bad. My left hip. It's getting to where I can barely walk. I know.
If there was one thing you could do, what would it be?
One thing for me to do, what would...
If there was one thing you wanted to do and could do, what would it be?
I don't know. I mean, I'd like to be able to walk or do stuff without pain anymore.
Things that people take for granted every
Yeah.
day. How many pills do you take every day?
My normal life, there's about 11 different pills that I'm on right now.
Now, earlier we talked about like some of your favorite things. Can you tell me some of the worst things that you don't like to deal with every day?
Well, I hate dealing with the pain that I have to go through every day.
Well, hey, Bill, I appreciate you doing this questionnaire and that for me, and thank you very much.
All right. If I could do more, I would.